So I'm Catherine Kyobutungi, the Executive Director of the African Population and Health Research Center that is based in Nairobi, Kenya. I have a background in medicine and I trained as an epidemiologist, and I have research interest in chronic disease management, which is a concept that sits at the intersection between prevention of non-communicable diseases and then health system strengthening. Why did I join PLOS GPH? I was approached during the COVID-19 pandemic, and at the same time, there were many debates about decolonizing global health that were prompted by the Black Lives Matter movement. And at the heart of those debates were discussions about shifting power, about forging equitable partnerships, among others. And I was an active participant in those debates, and I was beginning to question a lot of things about the global health architecture and about the global health knowledge system, how it is skewed, how it's broken. And having worked in the research organization based in Kenya, I had heard a lot of stories about African scientists feeling excluded from the knowledge system, either being disrespected or experiencing bias in the publication system. And so when I was approached, I really found the vision that was being painted rather compelling. And this was a vision that would center diversity, equity, and inclusion. And this felt really like an opportunity to actually do something tangible to contribute to a more equitable publication system, and at the end of the day, contribute to a knowledge system globally. I could see PLOS GPH becoming a home for work done by people from all over the world, and not some kind of exclusive club. And so that actually compelled me to sign up to be a co-editor-in-chief. So what sets PLOS GPH apart? We actually walk the talk when it comes to diversity, equity, and inclusion. It wasn't easy, but I'm proud to say that we have set up one of the most diverse editorial boards in terms of gender, in terms of geographic origin, in terms of affiliation and location. And the editorial board, it really is an outstanding board of people who are committed to the core principles of diversity, equity, and inclusion, and people committed to make a contribution, the global health community. And of course, in terms of financial accessibility, PLOS GPH subscribes the Gold Open Access model and is aligned with most funders' mandates. What else? It's indexed in major repositories such as Web of Science, PubMed, Scopus. And so it's a journal that has many other things that all other journals have, but in addition to that, has a very deep commitment to diversity, equity, and inclusion. The journal has had remarkable growth since its launch in October 2021. And PLOS GPH has really defied my expectations in terms of the number of submissions, in terms of the publications, I think in terms of acceptance within the community and brand recognition. And so I would really like to see the journal continue on this trajectory of growth, but would also like to see the journal continue to be a home for the community it set out to serve. And at the same time, I think it's important that the journal becomes truly global in nature. So I would wish to see the journal expand its readership and submissions from the parts which are currently underserved. That would be Northern Europe, North America, parts of the Asia Pacific. We would like to see submissions from countries like China, from South Korea, from Japan. So really making the journal more global in its outlook, I think, is one of the things I would like to see. I would also wish to see our formats expanded to accommodate people in the community who are part of the knowledge system, but who are not academics or scientists. It would be very nice to see PLOS GPH become a home for people who are on the ground and who are capturing and documenting their knowledge from the practice on the ground. Front-end healthcare workers, program managers, health administrators, policymakers. I would like to see PLOS GPH become a home where they share their experiences in ways that advance the field.